You are in your mid-40s. You are sleeping enough, but you wake up tired. You are training, but the muscle does not come the way it used to. Your energy, your drive, something feels slightly off. And at some point, someone tells you, it is probably your testosterone. Maybe they are right. But probably not in the way you think. Testosterone does decline with age. That part is true. From around your 30s, levels fall by roughly 1% every year. By your mid-40s, that is a real difference from your peak. But here is what most people do not tell you. For the vast majority of men, this is a normal, gradual shift, not a medical problem. True clinical testosterone deficiency affects around 2% of men. Not half of men over 50. Not every man who feels tired. 2%. The supplement industry would rather you did not know that number. So let me explain what is actually happening in your body, in plain language. Testosterone is made in the testicles. But the testicles do not act on their own. They respond to signals from the brain. Think of it like a thermostat. Your brain senses how much testosterone is in your blood, adjusts the signal, and your body responds. With age, this system becomes less efficient. The signal goes out. The response comes back a little weaker. At the same time, a protein in the blood, think of it as a binding agent, starts to increase with age. This protein grabs onto testosterone and locks it away in a form your body cannot use. So even if a blood test shows your total testosterone looks acceptable, the amount that is actually working in your body may be lower than that number suggests. That is why a single blood test does not always tell the full story. Now, which symptoms should actually make you think about testosterone? This is where most content gets it wrong. Fatigue. Low mood. Weight gain. Poor sleep. Difficulty concentrating. These are all listed as symptoms of low testosterone, and they can be. But they are also symptoms of thyroid problems, sleep apnea, depression, metabolic issues, and a dozen other things. On their own, they do not point specifically at testosterone. The symptoms that do have the strongest link to low testosterone are 3. A reduction in morning erections. A noticeable drop in sexual desire. And changes in how erections work. These 3, particularly when they come on gradually and together, are the symptoms that research links most clearly to testosterone levels. The others, like fatigue and muscle loss, may well improve if testosterone is genuinely low and treated. But they should not be the only reason to assume testosterone is the problem. That assumption sends men towards supplements, and away from the blood test that would actually give them an answer. So when should you see your doctor? If you have noticed those 3 specific changes, and they have developed slowly over time without another obvious explanation, that is worth raising with your doctor. You do not need to wait until things feel severe. And here is what proper testing looks like. 2 blood tests. Both taken in the morning. Both fasting. Testosterone is highest in the early morning and drops through the day. A single afternoon test can look low simply because of timing. Medical guidelines require 2 separate morning tests before any diagnosis is made. If both tests come back below the threshold, and you have the relevant symptoms, then real treatment options exist. Testosterone therapy is a genuine and effective treatment for men with confirmed deficiency. It is not something to take lightly, but if the diagnosis is there, it is not something to fear either. If your levels come back normal, then the symptoms have a different cause. And finding that cause, whether it is sleep quality, thyroid function, or something else, is the right next step. Now let me talk about supplements. Because most men start here, before they have ever had a blood test. And I think that order is worth questioning. The honest picture is this: most testosterone boosting supplements have very little science behind them. A few have some evidence in specific situations. Here is what does have some support. Vitamin D. If you are low in vitamin D, which is very common in northern countries, especially through winter, there is good evidence that correcting that deficiency has a modest positive effect on testosterone levels. This is not a booster. It is fixing a deficiency that was holding you back. I have linked a product in the description below. Zinc. There is a clear link between zinc levels and testosterone, and some evidence that supplementing helps in men who are genuinely low in zinc. If you eat a varied diet, you are probably fine. But if your diet is restricted, it is worth looking into. Also linked in the description. Ashwagandha, specifically the standardized forms you see in quality supplements. Studies suggest that in men with high stress levels, certain ashwagandha extracts may have a modest positive effect on testosterone and on how you feel overall. The evidence is not strong enough to make big claims. It is not a substitute for a blood test. But if stress is a real part of your picture, it is one of the better studied options out there. As always, speak to your doctor before starting any supplement, particularly if you have any health conditions or take any medication. 2 things I will not recommend: Tribulus terrestris, research have simply not shown it works. And D-aspartic acid, the evidence is contradictory and at least one research suggests it may actually lower testosterone at higher doses. Neither appears in any VARD IQ recommendation. Supplements can help with specific deficiencies. They cannot replace knowing what your levels actually are. Let me bring this together. Testosterone does decline with age, about 1% per year from your 30s. But clinical deficiency is less common than most people assume. The symptoms that most specifically point to low testosterone are changes in morning erections, sexual desire, and how erections work, not fatigue or low mood on their own, which can have many causes. Proper diagnosis means 2 fasting morning blood tests, not a supplement trial. And if deficiency is confirmed, real treatment is available. If any of this sounds familiar, speak to your doctor. Ask for a fasting morning testosterone test. That is where it starts. If this was helpful, please subscribe. We cover evidence-based health topics for women and men in their 30s, 40s and beyond, without the alarm, without the noise. Leave a comment below: which of these symptoms did you not expect to be on this list? The most asked questions from comments become the next video. And if you would like a monthly summary of what we publish here, you can sign up at verdict.kit.com/welcome, the link is in the description.